there's going to be something really important to clear up before we get started in the show about stem cell therapy or PRP injections. There are no quick fixes. There's no shortcuts or miracle cures out there. There is always a time component to any injury, and you can't speed that up. Regardless of what everyone tells you, whatever the pharmaceutical industry says or the surgeons say, or this magic new pill or this magic new drug, there is always a time component to the injury. There's no free rides on anything. There's always going to be a cost associated with trying to speed things up. So maybe there are some magical stem cell injections out there that do exist. I've heard like Joe Rogan and some people with a ton of money talk about how it's helped them, but I'm pretty sure they're like $50,000 a shot and up, which is pretty much unaffordable for us regular people. But the problem is you still have all these charlatans, or I call them modern day snake oil salesmen, peddling the cheaper version of stem cells, trying to cash in on the money train that is stem cells. You know, everyone's talking about it, but the type really matters. Another quick note on the idea, I've talked about this in past episodes, the idea of passive versus active treatment. You know, so many people want to like do nothing. They just want to get this magic problem fixed. They don't want to change anything. They just want to kind of go along for the ride. They go to the provider. I see this in my own clinics. They come to the provider. They got all these issues and they're like, here's my problem. Here's the fire I started. You put it all out. I'm not going to do anything. It's almost like they want to go up a mountain and they want you to put them on their back and carry them. I always say, I'm not going to carry your ass up the mountain. I'll help you and I'm going to be a guide. But so many of these magic or quick fix treatments don't require any effort, time, or sacrifice. So they're appealing to people, but they don't actually exist. So you have to take an active role in your recovery. You can't just lay there and be a lame duck and do nothing. So going to jump into the question a little bit more from Tori. So our first question, part 3 of the questions were, so what do they even do? What do these injections do? Now, let's classify. There's 2 kinds out there. There's stem cells and then there's PRP. PRP is short for platelet-rich plasma. So let's go through PRP first. I don't want to keep saying platelet-rich plasma too much. And basically what they say, when I pulled it up on the old internet and got an idea of what's going on, they say, let's see. It says platelet-rich plasma and stem cell therapy are both forms of regenerative medicine that work with your body's natural healing ability. It says growth factors in PRP stimulate your body's existing repair cells to work harder. Stem cell therapy boosts your body's repair processes too, and also introduces new cells to replace the damaged tissue. So basically, PRP is your own stuff. You know, they take it out of you, mix it up. And stem cells come from somewhere else. So that's the difference. So stem cells, how does it work? You know, basically they say stem cell therapy guides the formation of specific cells that can be used to potentially regrow or repair damaged tissue. For example, stem cells can be injected into a damaged patellar tendon in the knee to possibly develop healthy tendon cells to improve pain and function. PRP, it says, PRP therapy involves injecting concentrated platelets into damaged tissue, this is your own platelets, to stimulate faster growth of new and healthy cells. Like I said, stem cells come from an external source. PRP comes from your own body. So the next part of the question was, do they work? And if so, what is the best one? I kind of want to answer this question a few different ways. You know, it really just depends on how you look at the factor of something working. I put that in quotations. If you're here watching me, I'd be doing working. You know, if it's something that just takes away the pain and the inflammation, but doesn't improve the overall function of the tissue, it isn't an actual treatment. You know, think of another aspect to look at is the entire health picture. You know, in the medical world, we get so stuck in focusing on one single factor. Like there's damage to a tendon, maybe to the cartilage, to the ligament, and that problem must be addressed instead of looking at it more in depth. A big question you want to consider is, number one, was there a direct trauma to the area, or is it just a compensation? I covered that in episode 4 of treating the cause, not the effect of the problem. And then number 2 is just, how is the overall health of the client or the patient? Are they overweight? Do they smoke? Are they stressed? Do they not sleep? Do they sit on their ass all day? A lot of those factors, we tend to find, oh, it's just this one thing, and I got this bad joint, or I got this bad tendon, and this stem cells is just going to magically fix me, but I got all these extra problems. Like I said, that joint and that damage is the effect. It's not the actual cause. So based on the research, and what I did is I kind of did a deeper dive between PRP and stem cells. It would seem if someone were going to choose, stem cells would be the best option. Like I said, it comes from an outside source. And not only does it say what it does, it says it stimulates the body's healing the same as PRP, but it also increases the cells in there to help repair. So probably why the cost is a lot higher for stem cells than PRP themselves. I say though, it sounds almost too good to be true. The idea that you're just going to get, they said on some of the websites I read, you get 2 or 3 injections. You don't have to do any real work and your problem will magically go away. And of course, it's only going to be, tens of thousands of dollars for that. I read somewhere there's some that are like 50, 100,000. Maybe those ones do work because that's some high cost stuff. But it's these people that are peddling stem cells and PRP injections together, making it like this magical cure. They might be like $400 or $500 a pop. You do a bunch of them, but they're not actually fixing the problem. And then you're out of that money as well. So if you really think that you're going to get this magical injection, maybe you're overweight, maybe you smoke, maybe you drink too much, maybe you don't exercise, maybe you're old as hell, and you're just going to get this magic thing, not have to change anything. If you believe that, I'd be happy to sell you some magic beans from a leprechaun that's riding a unicorn. Kind of being a little mean there, but it's the truth. No shortcuts. So last part of the question. If I did get them, how can I be assured I will get my money's worth? First, I want to clear up in what type of situation I would even consider getting stem cells. And remember, on this show, it's the advice I would give myself. I'm not giving you direct advice because I'm not your doctor, but this is what I would consider for myself. What would even make me consider stem cells? First, what I would want to do is I would want to get rid of all the scar tissue that built up around the shoulder, around the tendon, because that was a problem in the first place. The muscles, the fascia, the nerves, they get loaded up with scar tissue. I covered this way in depth on episode 2 about scar tissue and the formation of that. What happens then, it puts the pressure on there. So that, I always say the tendon is kind of like your thumb stuck inside a car door, and the car door is all that scar tissue around there. You can't give that a chance to heal up till you remove that. So if you just go in and try to magically fix the tendon, you're fixing the effect, but you're not actually getting to the root cause of what's going on. Next, I would be honest with my current health. Am I at a good weight? Do I exercise? Do I sleep enough? Are my stress levels low? If not, then don't even waste your time or your money. So if I got all the tissue cleaned up, I got my health in order, I'm pretty good functioning, and I'm still having pain and I'm still having discomfort, then I would consider stem cells, not PRP, definitely not PRP. I would consider stem cells to help regenerate the tendon. But what I would do with the doctor or the clinic trying to sell me that I'd ask for the following agreement. I'd say, you know what? I'll do these stem cell treatments as long as we have a pre-MRI and then a post one possibly 3 to 4 months later to see if it did in fact get better. If it did not, I would like a full refund for all the cost. If they truly know what they say and it will work just like they say it will, then they'd be totally fine with that agreement. But I'm pretty sure you won't find a doctor anywhere willing to do that because there is so many other factors involved. But what they do is they play on our human nature for this idea of a quick fix with no effort. It just doesn't exist. It just doesn't exist. So don't fall victim to these type of things. There are no shortcuts in there. You have to look at your body as a whole, not just one isolated thing and this magical thing's going to happen. I've had this with people that have come in, usually people that spent $5,000, $10,000, $15,000 on it, and they want to believe that their problem is better. There's this thing called the placebo effect. If I inject myself full of something that costs $15,000, you know what? I'm going to probably convince myself that I am a little bit better. But the way I live in my clinics and the way I train people is look at factual data. Is it functioning better? Do the imaging look better? Is that real data? Like that whole hey, it feels better. Like, yeah, I wouldn't want to sound like an idiot either if I spent $40,000 on some stem cells and I'm not any better. Like I'd be like, of course, I swear by them. But you know inside what the truth is. You know if you're truly better. And all those people out there that say they swear by it and it's magically fixed all their problems, there's probably a mental issue in there. And a lot of their pain was probably just in their head. But like I said, maybe the real expensive ones, $50,000, $100,000. Maybe there's some deeper stuff there that I don't even know what's going on that they hide from us. But like these pop-up clinics that are charging, $500,000, $5,000 for PRP injections are just taking your money. They're robbing you, and you're just being dumb by following that because there are no quick fixes. So thanks so much for the question, Tori, and I hope this episode helped. Please support the show by sharing it with others. If you have any questions or topics you want me to cover on AMA, just send an email over directly to us. All that information is available in the show notes. If you're looking for real answers about what may be going on with your own injury and you're tired of getting jerked around by the medical system, then please reach out and request an injury consultation with our team. All that information is available in the show notes or wherever you might be consuming this content. Thanks for listening, and we'll see you guys on the next one. Bye. In this episode of Ask Me Anything, I got a great question from Tori on Instagram. I have been dealing with shoulder pain from a partially torn rotator cuff and bursitis for the past year. I have done 3 rounds of physical therapy, lots of massages, had 3 injections, and haven't seen any improvement. I even think it might have gotten worse. I am not considered a candidate for surgery yet because it is only partially torn, but it is getting worse, and I want to be able to function better and just feel better. I started looking into stem cell therapy, and it was rather confusing and vague about what it does and if it can actually help. Plus, the prices are so high. My question is in 3 parts. Number 1, what do they even do? Number 2, do they work? And if so, what are the best ones to get? Number 3, if I do get them, how can I be assured I will get my money's worth? I do my best to answer all of these questions in a factual and non-biased way, which I know isn't normal in the medical world full of lies, false promises of miracle cures, and lots of ripping people off. I hope you learned something new and enjoy the show. Welcome back to the Injuries Explained project, where we are on a hell of a mission to make chronic injuries obsolete by helping anyone that is injured and in pain get properly educated and informed on all their treatment options so they can have the best possible outcomes without ever having to resort to pain pills, injections, or surgeries, which only make things worse. My name is Dr. Matt Maggio. Thank you so much for stopping by and checking out the show. Just a quick disclaimer before we get started. All of the information presented in this episode is strictly my opinion and in no way, shape, or form should be misinterpreted as concrete medical advice or recommendations. If you're currently injured and in pain, please reach out to a qualified medical practitioner for a full diagnosis. If you've already done that, you haven't got any real answers, you're frustrated as hell, you just want to know what's going on and get down the path to getting your injury fixed and solved, you can reach out to us directly for an injury consultation. All of the information to do that is available in the show notes or wherever you might be consuming this content. Now that we got the boring stuff out of the way, let's get right into the show.